can I see them wince? Because mice can wince. Mice have grimacing that they do, just like humans. Uh,
Wow.
and so I'm interested in seeing all of that. We have a laser head, and I give laser to mice because I'm interested in looking at their pain responses. I want to see if I condition mice to associate a tone with a specific painful stimulus like a laser, if there's any expectation or anticipation of coding that's happening in the neural side of things. And then at the behavioral side of things, I'm really interested to see, like, is there anticipatory like behavior? Like, for instance, kids, when they get a shot and they see that the needle is
Right.
sticking, they have like anticipatory behavior where they're like, oh my God, I don't want to get this. Kind of curious to see, if I can quantify that in mice, and then if that's relating to anything in the secondary motor cortex.
I grew up as being an athlete, right? And there's very much a philosophy there of like no pain, no gain, push through pain. And you think of that as maybe a very human thing. What is your interest in studying that?
Pain is really just a cost benefit decision making system. It's weighing out all your options and seeing what is the most effective and beneficial way to protect the body. And so, if you're injured in your back and let's say you can't bend a specific way, you start associating that, okay, if I bend this way, I'm going to keep feeling pain. So, what happens is oftentimes when patients will recover from a back injury, the tissue has healed. They still have these quote unquote like maladaptive behaviors where if they bend, they're still feeling pain for some reason, even though that injury isn't there. And so there's actually different types of therapies that are out there, such as pain reprocessing therapy. It's like retraining the brain because it's been rewired from, having pain to anticipate it, to try and like rewire it back again to not anticipate that type of pain. And it's interesting because it's used as a therapy, but we don't understand like where this plasticity is happening, how is it happening, at what time and place does it take place during the time point of when a person gets pain. It really prompted this my thesis to try and see if we can figure out like what is going on in the brain.